next session on selecting the topic. So what are the sources of information for me to select the topic? Now, selecting the topic is an important milestone in the ICMR STS project journey. This is one of those early hassles that you pass through. Since you are probably in first MBBS or second MBBS, a lot of subjects you are yet to study. You have not probably been exposed to clinical medicine and all the clinical subjects, and hence selecting a topic might feel a little more challenging to you. So this is a small segregation of the sources of information which might help you at narrowing down the final STS topic that you wish to do. I'll start with the first one. Is if you do not have much clarity around which is the topic of your interest, I mean, what topic do you wish to go forward with? Think of your interests. Your interest might be in the 20 different medical subjects which are taught in medical college. So, say for example, in the first and second MBBS, I might be exposed to anatomy, physiology, and biochemistry, a little bit of community medicine in second year, pharmacology, microbiology, pathology, and forensic medicine as well. Right, but about from the clinical subjects, you might be exposed to, say for example, you might have some of your relatives who would be doctors and practicing, and you might have had an opportunity to observe that particular subject more in detail. So that might be one of the reasons that you are interested. First reason could be the subject of your interest. Second is there might all of us have personal experiences, right? And our personal experiences many a times influence our life journeys as well. So, say for example, if I have someone within the close family or extended family suffering from a particular chronic disease, I might be involved in giving care to that particular person, supporting and helping that particular person within my close or extended family. Probably I would have some interest in that. So, say for example, if I have a person with epilepsy in my family, I would be interested in that. If someone else has some neurological disease, I might be interested in that. I mean, looking at the current prevalence of non-communicable diseases, it's very likely that all of us in would have at least someone in our extended families who would have diabetes or hypertension. So if you are caring for them, you might be interested in those areas as well. There might be subpopulations which you are interested in. So, say for example, someone might be more comfortable dealing with children, and they might say that I wish to do something with pediatrics. Someone else might say that there could be different occupation groups. So, someone might feel that I wish to do some research among the IT related workers. Some else might say that in our hospitals, a lot of patients belonging to, let's say, a particular industry come as patients, and that particular industry is nearby and employs a large number of people. So that's an easy population with easy access. So you might do that. If your medical college belongs to a coastal area, there will be a lot of people who will be engaged in fishing as occupation. So you might be having access to fishermen as a community. So that's possible. So if you feel that that's something which interests you, you can do that. Second is the guide's interest. So the guide for sure is a subject expert in their own specialty. So what they bring to the table is a lot of clinical relevance. So say for example, if I'm interested in some doing some research in medicine, and when I go and meet my guide would be able to tell me that what I'm interested in, does it make clinical sense? Is it clinically relevant? Because ICMR STS prefers to take up diseases which has Indian relevance. So, say for example, when I look at the theoretical literature in different specialities, I might come across something which is interesting to the student, but might not be interesting to the guide, because the guide would feel that we do not see many patients of that particular disease in India, and hence it would not be fruitful to take that up as STS project. It has less chances of getting selected. Your guide would be able to tell you what is clinically relevant in India, and hence stands more chances of getting selected. The students can look at the previous articles. So ICMR STS is running for almost many decades now. So ICMR STS has supported with stipend a lot of student research projects, and a lot of students also go on doing research projects beyond STS as well. So as part of this course, what we have done is we have looked at the recently published literature, recently published student research reports in the form of articles in probably published in last 2 3 years, and we have prepared a list for you. We have kept the list on the Google Classroom itself. So you will find that under the at the end of this session, you'll find them under the session one topic in the Google Classroom. It is a list of 50 topics which are recently done. And to make your job a little easier, we have also given a separate column which suggests that these topics are primarily belonging to which particular subject of the medical curriculum. Now, many articles are such which runs across multiple subjects. So, in that case, we have identified only one of the related departments or subjects. Apart from this, the ICMR SCS also wants that many student research be focused on Indian priorities. So it would be also a good idea to look at what are the ICMR priority areas of research. So fortunately, ICMR has come up with two different documents which talk about what are the priority areas in research in India. So if an Indian researcher wishes to do a research, these would be the areas in which ICMR is interested. They are the national priorities. So when you will be writing the proposal, usually it would be a good idea to identify that your proposal or your topic of interest also falls under those priority areas. It's very likely that your research topic will fall into one of those research areas. And in your proposal, if you can refer to the ICMR documents, probably it would add strength to your claim that this is an important area to study upon. Now, these are the different subjects that we talked about in the previous slide. So these are the subjects that you will be allowed to choose from. So they are a little more than the 20 subjects of a medical college. Some of them, they are super specialties as well. So things like emergency medicine would fall under accidents, injuries, and trauma. There would be subjects in the allied sciences. So, for example, if you are doing something with the nurses or nursing students, or your topic belongs to, let's say, physiotherapy, or your topic belongs to something related to the Ayurvedic and Ayush practices. Then there is anatomy and forensic medicine clubbed together. So when you will be applying, you will be asked to choose one of them. Sometimes your topic might be cutting across two different specialities, in which case, choose someone your primary guide belongs to. Choose a department that your primary guide belongs to. You'll also find uh, topics such as obesity, nutrition, and dietetics in the mid part in the second column, which is cross-cutting multiple departments. So nutrition touches biochemistry, nutrition touches physiology, touches pediatrics, community medicine, medicine department, and a lot of other departments as well. Okay? So a lot of choices there. The next one is type of study. So we'll get a little clarity as to what do these different types of studies means. So it is clinical investigation, or so something that can happen with regard to history taking in the clinical departments, or uh, getting physical examinations of the patients. It could be epidemiological investigations where you go to the field, let's say, do house to house surveys and get some information from people. Or it could be field operational research. A public health program is running, and then you do something to improve the program. Or health education, educating people around the issues around health. Or it could be laboratory investigations, it could be product development as well. Also, although we see a small proportion of projects around product development, but we'll see a couple of examples probably. Or finally, it could be about therapy. Therapy means treatment and managing the patients. So management is a more broader word. The treatment would be probably with the drugs, and management involves a lot of other aspects as well. Let's say for chronic disease, teaching the family members how to care for the person, taking care of the other aspects of patient's illness. So, for example, the functional status of the patient, associated comorbidities, managing them, educating the patient about the lifestyle interventions, about diet and exercise, and so on. Right. So let's take a few of the examples and understand these different types of studies. So with regard to clinical investigation, these are some of the examples. So there is a study published which says that it's a study on type of skin diseases occurring in commercial among the commercial fishermen. So probably this is coming from a medical college which is a coastal, and they have access to a lot of fishermen as patient population. And probably the study was done from a guide who was in skin department. And it's a very simple study among fishermen. But why, how this study becomes focused is it's a simple study of what are the common skin diseases only. But then it is in among a specific community of fishermen. So skin department OPD in a medical college would probably a lot of people can come in. But this is particularly focusing on one particular patient subpopulation. Second is impact on polycystic ovarian syndrome, which is increasingly common nowadays on the health related quality of life. So quality of life is also gaining importance these days, and there are tools available of multiple questions. If, for example, 15 questions you ask to the patient, and the tool gives you the score as to what's the score of quality of life of this particular patient. So they are tools of health related quality of life in general, or in some cases, disease specific quality of life as well. So this is one such involving such a tool on polycystic ovary syndrome. You would apply those tools mainly among illnesses which, let's say, which has substantial impact, substantial social burden, or substantial long duration that it would affect their quality of life. So it would be important, if it is not studied, to study them in more detail. So things like epilepsy, things like neurological problems, or things like stroke, and so on, where the quality of life would be affected, would be or let's say chronic kidney disease, the quality of life would be affected. Thyroid dysfunction in pregnancy and how it affects the maternal outcomes. Effect of contralateral, the last one comes from physiology. So we understand that when we have an accident and one of our limb is not exercising, uh, it can have problematic effects. So then but the contralateral limb is something which can exercise. So if we exercise in the contralateral limb, the study proves that the circulation in the affected limb also improves. So it's a very simple study coming from physiology, but published in a good journal as well. So that was what we can do with clinical investigation as a study type. Laboratory investigations. So the recent studies, one of them says that prevalence. So this study is around antimicrobial resistance of for a particular one only microorganism, which is Klebsiella. So all the Klebsiella pneumonia samples, and they are interested in finding out what proportion were hypervirulent. So this is a new phenomenon happening, that hypervirulent strains are coming up. So study coming from microbiology. Another study was coming from pediatrics, the intensive care unit in pediatrics, where they say that in pediatrics ICU, since they want the values very fast, they have a habit of having a portable analyzer. So they many a times need the serum lactate values, and they use portable analyzer in ICUs. But here, laboratory auto analyzer gives more robust values. So they wanted to calibrate whether the portable analyzer that they are using within the ICU itself, whether it is giving correct results or not. So they did on a sample of serum samples, they did the study and compared whether the portable results are confirming with the laboratory results or not. So very simple study, but very meaningful. Epidemiological investigations, few of the examples. So say for example, in the area that your medical college belongs to, or has is in rural area, and that in that area, if snake bites are an important public health problem, a simple study on whether the residents of that particular district know the different types of snakes. So the types of snakes which are medically important, we say that uh, it's important for people to identify, and hence your treatment would depend upon the type of snake. And snake initial management, the first aid of snake bite management, are people aware or not? Because there could be a lot of myths prevailing, right? So such studies are locally relevant. It's important that these studies are done. So when you develop health education material or do any kind of exercise through any channel about educating the same community, if you are aware about the myths, you can debunk those myths. So such kind of research, we call it as translational research, which means that what type of snake causes what kind of poisoning is known to medical science since many years together. But does that information reach to people whom our hospitals serve? So that's an important question. So if our small study can answer one part of the puzzle, can answer one simple question as to what are the common myths, it would be interesting and it is worth publishing. ICMR STS for sure is looking at such topics. Healthcare access and utilization among transgender people. Now, transgender is a small, very small subpopulation of India, but they are very, very important. And we understand that since decades, since ages, that's something a population which has faced social isolation. So anything to be done among them, anything to be done among such vulnerable populations has a better chances of getting selected, because there is very little amount of data, information, and evidence around what is happening such kind of vulnerable populations. public awareness, and this is such a very simple study, public awareness on appropriate disposal methods of unused and expired medications. So that's something which is all around us. All of us have unused and expired medications at our home. Now what do we do with that? What's an appropriate disposal method? Are people in general aware about that? So understand that it's something which is so common, so easy to be done, but very specific and focused. So whatever you do, if it is very focused, probably more chances of getting selected. Also, it would be more meaningful. The last being, can secondary school students correctly read the nutrition label on packaged food? So school curriculum is also increasingly expecting the student to be more aware. Packaged food consumption has become almost universal, not in only in urban but in rural areas as well. But what proportion of our students are able to read the nutrition label correctly? Do they are they even aware as to how to read that? Right. So someone who is looking at it would be interesting to see. Field operational research. So, for example, factors affecting the reporting of adverse events due to medical devices among doctors, qualitative approach. So, many of you who are in second year understand that adverse drug reactions reporting is part of the pharmacovigilance program in India. And many of you, as part of your pharmacology, either would have already be doing or would probably, in the event of time, be filling up the adverse drug event forms. So that we on a continuing basis develop database of what are the common adverse events happening because of the different drugs and if there are any changes. But similar, uh, apart from drugs, medical devices are also, the usage of devices also increasing, and that's something which is new. So what are the doctors' thoughts about any adverse events happening because of medical devices? So, say for example, if there is a batch of contaminated needles, contaminated syringes, which is supplied, and if infections, hydrogenic infections occur because of such contaminated supply, where the doctors report. So are doctors aware about it? So that's an interesting area. Second is, we have a large number of pregnant women who are anemic. And iron and folic acid, oral tablets is something which is commonly prescribed to them. But we understand that the compliance is very low. So, not all pregnant women, although it's necessary, not all pregnant women take the medications for the required duration of time. So we say that among pregnant women, it is 6 months, one tablet per day they should be taking. But if they are not taking, what strategies work? So one of the strategies that the students thought is, can we teach the family members and give them some kind of an action-oriented material? Probably, can we give them some kind of mobile reminders or some kind of a diary? So direct monitoring by family members, can it increase the patients actually taking the medication? The third one is, people who get delivered in government hospitals. The government hospital delivery is free, but there would be a lot of costs associated with getting admitted. Some kind of direct costs, indirect costs as well. So we usually expect that the person who gets delivered in government hospital should not have to spend anything from their own pocket. But does that really happen? So a study on health economics on asking the patients admitted to obstetric unit in my own hospital and finding out what's an average expenses that they have. We might expect it to be zero, but patient might be spending somewhere around 2,000, 5,000 rupees even in a government hospital. The last one is interesting. So they wanted to find out that a lot of plastic waste would collect small amounts of water, is a breeding places for mosquito, and hence can lead to dengue outbreak. So they did this wonderful study, finding out from within the city which are areas where the dengue outbreaks are very common, and went into that particular area, surveyed 100 households, and found out what proportion of households had plastic waste littered. Compared that to another area within the city where dengue cases were very less. Surveyed 100 households from that second area and tried and compared that what proportion of households in both of the areas were having plastic waste. So very interesting findings there. Very simple study, very focused, but practically useful. Something around health education. Now, this is a very interesting category. So, say, for example, this could relate to something around, let's say, when we do something around educating the patients about their disease, or how do people care for themselves with related to health, or it could be about medical education, so health professions education in general as well, right? So, say for example, many a times students come up with things which directly affect them, and for obvious reasons, right? So, since you are first and second MBBS students, there will be a lot of issues that you would be facing. Now, interesting to see that some of these students in the past had the courage of picking up those topics and ending up getting selected and then published also in good journals. So what you see on the screen are actual publications. So in your Google Classroom list, you'll be able to find these titles, and if you paste those titles in your simple Google search, you'll be directed to these published articles as well. These are actually published articles. So, say for example, one of the students said that the violence against healthcare workers is increasing. Everyone is concerned about them. But are the trainee doctors and nurses, so MBBS students and students who are studying the nursing curriculum, if they were faced with such a hypothetical scenarios, are they aware as to what would they do in such a scenario? So it's a very, very simple study how trainee doctors and nurses react to simulated scenarios of violence against healthcare workers. Second is on we see that since now with the NEET undergraduate and NEET PG selection process, a lot of students migrate from their own native states to other states where the language is an issue. So some of the students understood that the, the students are part of their own batch students who are not knowing the local language face a lot of difficulties. So this is an issue which all of us probably would have seen happening around us, but some interested student took it up, that he or she took it up as an STS project, got selected and published as well. So it says that perceptions of students themselves who have language discordance, which means that they are studying in a medical college and interacting with patients, which is a language which they don't know. So if that's the case, how does it affect their studies? So it's a simple paper. uh, Patient outlook on bedside teaching in medical schools. This was a very interesting study where they say that uh, uh, be it a government medical college or a private medical college, the medical students are directly involved with the patients. So in history taking, physical examination, and so on. Uh, have you ever thought as to how acceptable would it be to the patient to be interacting with a trainee doctor? Right. So patient would, all of us understand that if we put up ourselves into patient's role, we understand that we would probably be preferring to talk to someone who is an authentic doctor, who is a confirmed doctor. How much open would we be to talk to a trainee doctor? So they took this up as a project and interacted with patients and documented what are the patient's expectations and identified areas that patients would be fine sharing this much amount of information with this level of doctors and so on. Very interesting article. And then there is something else. The last one also fits into the product development as well. So the we might I as a student might not be completely developing a new product, but there might be other people who might have developed such a product. So if I can test that product, if I can get access through my guide, if I can get access to people who require that particular product, and then probably document as STS, that's still possible. So say for example, there is a Farm Vigil app which is available on the App Store. So these students utilize that particular app, which might be free to use, and they analyzed the dermatological adverse reactions reported. Right. So this was an interesting study once again. So they just documented the usage of an app, how much is it helpful in increasing the reporting of adverse drug reaction in one particular department. So probably this is the last type of study, which is therapy and management. So we understand that ICMR does not allow us to do clinical trials. So say, for example, if there is a novel molecule, a new drug which has come up in the market, the undergraduate student will not be able to do a clinical trial and prove or disprove the efficacy of the new drug, right? But there are a lot of things around managing the patient, around which we can probably do an STS study. So, if, for example, if my in my medicine OPD, a lot of patients who are chronic in follow-up of hypertension, high blood pressure is coming up. Probably it would be a good idea to identify the patterns of complementary and alternative medicine usage among them, because we understand that many of them also are parallelly taking medications from them. Some of them might not be qualified practitioners, right? So that would be an interesting thing to do. Gaps in infection control practices of tuberculosis among patients attending a designated microscopy centers. So your TB chest, your medicine department, urban health center attached to community medicine, all of them would have be having patients with tuberculosis, and we expect certain patient to be taught certain infection control practices, and then patient to be following. So are patients actually aware about them? Are patients really following those advices? So very simple study around that, but more meaningful. So if the conclusion is that not many patients are following, probably something needs to be done about it, right? So it's clinically relevant. So we purposefully took those examples. Those were only a few selected examples that we discussed just now. The entire list of 50 topics you'll be able to find in your Google Classroom and refer to them. Uh, on this slide, we are almost towards the end of this session on selection topic. In this slide, we'll just share based on our experience, what are the criteria that you should be keeping in mind. We have seen a lot of students going with a lot of research projects and not getting selected. And we have also seen a proportion of students getting selected. What is the common difference that we see? So primary, as we go towards the next step in the next week, we'll talk more about this. But at present, in topic selection, it is useful. So we are taking three important criteria. The first and foremost is look at feasibility. So look at whether, let's say, if you are taking up patients from your hospital, do you have access to patients? So identify a disease where a reasonably large number of patients are coming. Don't pick up a disease where you don't see so many patients. If your study involves some instruments, identify that your department has those instruments and you will not be required to outsource investigations. So, for example, in case of lab investigations, if you are doing something which a novel procedure, uh, uh, please ensure that that procedure, there is sufficient instrument available, there is sufficient resources and reagents and consumables available for that procedure, that there is a sufficient amount of expertise available with that particular procedure, that when you actually start data collection, it's likely that that procedure still would be happening. We just recently came across a student who tried a novel surgical tracing procedure, but then the department discontinued the novel procedures, and then the student is finding it difficult. The second aspect is relevant. Here, your student, your guide would help you identify whether the topic is relevant or not. If it belongs to ICMR priority areas, more chances of getting selected. The last point is the novelty. So many of the time students feel that the topic has to be very novel for it to be selected, since it's a competitive process and only small number of proposals get selected. So students are always under pressure of finding out something new. So I would tell them, so it does not need to be very hi-fi topic as such. What it needs to be is focused, right? So previous examples were all such examples of being focused as to what specific disease that you are interested in. Within that, what particular aspect are you interested in, right? Or a patient subpopulation. So if your topic is very focused and narrow, probably more chances of getting selected, right? So a focused topic on a priority area is a short ticket to ICMR STS selection. The last couple of slides, we thought it relevant to discuss about how do we. So some of you might not have identified a guide for your own research topics, right? So whether you select the topic first or whether you select the guide first, what happens first? I would say that it's a iterative process, both goes simultaneously. So this is the first guidance, that who is eligible as a guide. So within your medical college, so the regular full-time faculty from medical college, this comes from the STS website. It means that assistant professor, associate, additional, and professor are eligible within the department faculty. Part-time faculty are not eligible, visiting faculty are not eligible. And within the departments, we'll find tutor cadres as well, demonstrators as well, and postgraduate students also. So they are not allowed to be guide. So guide is anyone who is assistant professor and above. So this comes from the ICMR STS website. Now the next slide comes from our experience. So identify someone. So these are our tips as to how you should be going on approaching the guide. So identify someone who you are comfortable with. So identify the topic of your interest, subject of your interest, and within the subject, ask your senior students as to who are the faculty members who have previously guided the students whom you find comfortable working with. When you are meeting the guide, usually it would happen with the guides who come up with good quality research, who are very meticulous, would usually be busy. So they might not give you sufficient attention. They might not be ready to become your guide, and that would be the usual case. So you will have to convey your commitment. So you'll have to meet the guide multiple times. The guy, your guide, whom you are aspiring to be uh, getting guidance under, you'll have to meet them multiple times. So your meeting multiple times would probably convey your commitment to the STS project. Many a times the students do not complete small tasks. So it would be always a good idea that complete small tasks that your guide suggests. Many a times the students might feel that what the guide suggests is not meaningful and they skip on one or two important tasks. But many a times the guide would usually not be committing to students. So many a times guides have a habit to offer small tasks to students and see how the students respond. The students might feel that this is a very small task and I'm not interested. So if you complete small tasks given you by your guide in the initial phases, that would probably repose faith in you, in the mind of the guide, that the student is flexible, the student is taking commands, the student is following instructions, and hence, which probably means that the student is committed, right? So that would be important. Whenever in doubt, uh, always it would be better to communicate with the guide rather than many a times if there would be multiple topics that the guide would suggest. You would do some quick literature search, and you yourself would reject many of the ideas, assuming that they might not be feasible or they might not be interesting or they does not look worthwhile pursuing. But always share your doubts with guide, that why do you think that you are not interested. You might feel that we don't see that patients from that disease coming to a hospital. We might feel that that instrument is not available in our medical college. So but then always talk to the guide. The guide might be able to find out a work around that particular problem, right? So always, so once you have sufficient understanding that your guide is committed, have trust in whatever the guide is sharing their valuable information with you. Clarified, these are the last part is an organizational way. Clarified preferred modes of communication. So sometimes the guide might feel that for all the academic communications, email would be preferable. You ask your guide whether a WhatsApp chat would be preferable. Does your guide allow you to call them, or they are preferring in-person meetings, right? Prefer whether sometimes the guides have a preference of looking at the draft protocol versions in print mode. Some guides might be comfortable in looking at soft copies as well. So ask preference and follow accordingly. So this last part was are some tips based on our experience as to how can your mentoring relationship with your guide be made little more comfortable on both the sides. So that was